One thing I really appreciated getting just the reframing of it once I was in the VBAC group. It's something that it had crossed my mind, but just not the wording of it. But it's so simple, so much the cascade of interventions ever since the Business of Being Born came out, that really became like the catchphrase that if you go to the hospital, you're gonna have the cascade of interventions that are always gonna lead to a C-section and all of that. And it's always framed as like these providers who are trying to get you to have a C-section. And I finally remember seeing one time one of the admins in VBAC, it might have even been you, Candace, I think, but I know multiple people have pointed out, no, like if they were just they would just give you a C-section then, like if they're clearly trying to do interventions to try to get you towards your vaginal birth. They are trying to get you there. They're trying to do things that will help progress your labor, that will keep, that are evidence-based to help you have, they're not trying to give you a surgical birth off the get-go, or they just would. Why would they waste all of that time and resources and all of that if they would just give you the C-section then?
Karen's really good about that advice. Like she's always, have you tried the peanut ball and stuff like that, and giving like that type of advice. But like she's always like, no, their goal is to have a healthy birth and hopefully a vaginal birth, because ultimately we know that's safest for the baby and the mom. Usually, we'll put it that way. But when they have to pivot and they see these births day in and day out, unlike home birth midwives. So they know before it's going to happen. So you may feel like you were, and I did too, with these birth groups, like with my first. I thought nothing, like his heart rate was going down, and had no issue with that birth and having a primary C-section. But then you get in these groups and I'm like, they should have let me go longer. They tricked me into a C-section and all this. And you just start, second guessing. And of course, like I can recount my births couple, all the time, and it always kind of changes. So you remember the most important parts, but you don't remember like these doctors explaining it to you, or in the, in the moment they're not able to, like they have to get it important and get across because your baby's life or yours might be, in danger. So they're always kind of like one step ahead. We see this pattern going. Yep. You're probably not going to be able to deliver vaginal. Could you? Possibly. But then they have a lot more risk going on too. So that's something else, like what we see too in these groups, when people recount their birth stories and feel like they were cheated, I guess you could say. And then we've seen so many of these, and we have so many medical providers in the group that do know how this goes. So that's a lot of times where the team, the admin team, and even members in these groups are coming from, these evidence-based groups. I'll say that. We're not trying to get you to hate your provider. We're not trying to get you to second guess your birth, all that stuff.
I think too, one of the things I noticed in some of the birth, well, not even necessarily, so this will ripple it out a little further. A lot of us are in, and I hate to call them this but not as inclusive of a term, but people know them as moms groups, like other groups. They're parent groups, but they are primarily women or people who identify as women. Some of them are more like not very inclusive. And I've just been, I was in them a long time ago or things like that. I find that overarching moms groups are sometimes just filled with everything and a lot of dangerous advice. And one thing I have always noticed too is when someone is really pushing towards like an out of hospital midwifery model of care versus, why you got your C-section in the hospital, they'll say like the things like you were saying, kind of, Candace, wow, they pushed these interventions on you and you got the C-section. And if they had waited longer and they had been more patient for your body and everything else, you could have had a vaginal birth. And the reality is, to some degree, they might be right. Like an OB may have decided to do a C-section. Like my OB had with my first, and I had shared this in my story last week or so. I had said, my OB at that time with my first, I had choreo, and she said, we could give you a little longer. I don't think it's worth it. You don't look well and you're not doing well and your baby's not doing great. Like you have probably a little more time before we have to really like call it. But right now I just advise you to have the C-section. So in these scenarios, they probably could. And they might even have a living baby when they deliver vaginally, but that's not always the better. A vaginal birth isn't always the better outcome versus the C-section at a really good timed C-section is much better than we let her labor for 6 or 7 more hours and she had a vaginal delivery, but at what cost? Like, what did you suffer? What did your baby suffer? Was it really the best move? We have to get out of this. And society, I know a pendulum swings around birth and how we view it in different time periods, but we have to get out of this mindset as a society that a C-section is the worst outcome that you can have in a birth, and that a C-section is always less than ideal comparative to a vaginal birth. Because in so many scenarios, even ones too where at the end of the day, baby is safe, but like we've talked how many people have we talked to that we know who the person giving birth has had such significant tearing and things like that they're never the same again, that the pelvic floor therapy and reconstructive surgeries and things that they have to have, and they're just never the same. It's terrible. I feel awful for them. So yes, there is maybe some truth when they say, oh yeah, and if the midwives would have just let you go longer, and if you didn't have this obstetric model of care, then you would have just delivered vaginally. Maybe. At what cost? Is that better? Maybe, maybe not.
Right. And there's a lot of, with these online birth groups, there's a lot of blame placed on the birthing person in general. And I've seen that over and over. And I think that's where it's shifted. I think even in the past, maybe even decade, with these online birth groups, and everybody can kind of share their story. So you're not just talking to maybe your sister or your cousin about their birth. You get all these stories, and then you do get like these, I don't even know what to call their thinking, just the natural childbirth community. And we've seen it with other admins and different groups where they've never even had a vaginal birth, and they are so hyper focused on this, VBACs or vaginal births at all costs, that they give medical advice, they give unsafe advice, and babies have died in that. And these people come into these groups wanting to hear positive stories, positive vibes. And if that's all you get, you do not get the riskier side to it. And I know a lot of these groups do shun people that come in and share stories that don't align to what their message is or what they want out there. Like, oh, you had a uterine rupture because, of what you did, or you allowed for them to give you an induction or whatever it may be. And even people don't speak up when they've actually just scheduled for a repeat C-section, and they, eventually lie about it online, so they don't have to, announce or say, I wanted this repeat C-section. They'll be like, well, the doctor eventually talked me into it, and that's okay. But it's sad to me that people have to lie. And I know when I had my third, with my second, I had a VBAC. So I was going in my mind, that I was going to have another VBAC because that's what you think. And that didn't happen. I tried, and I was induced like I was with my second, and it just didn't go according to plan. And that's fine. But I remember when I woke up and kind of posted about it just on Facebook and in the birth groups, people, they didn't like congratulate you, didn't ask how you're feeling or anything like that, especially after having major surgery, you're knocked out, that type of stuff. And they just asked, well, how was baby born? And it's just like, why is the focus where he is born? And I do remember in certain groups, you knew which groups you could not and could be honest about it. So in some groups, I wouldn't even say it. In other groups, I'm like, yeah, it was, a stat C-section. But there's some groups where you just didn't want to. And I remember, I think my sister had responded to somebody on my own Facebook post that said, oh, it was really scary. She had to have a stat C-section. And I'm like, why did you say that? I didn't want people knowing. So it's just like the shame behind these things, and in these groups that carry out into your like real life too. And it's just something that we're kind of want to change the narrative. And I think we've been doing a great job on. There's a few, birth groups I'm in that have been changing that and have helped a lot of people, So I'm glad to be doing that. But I guess the general message is these online birth groups are, we've seen so many deadly advice censoring of people with bad outcomes. And a lot of these other groups, we do see the push for, oh, let's go the home birth way, because they feel like, you know, you're being cheated or robbed of your own birth in these hospitals, and they're not going to let you go all natural and achieve this vaginal birth and everything. And, you know, that's just not it. So that's what we aim for. I know specifically in some of the groups that I admin for too, is just to turn that narrative. And sometimes our tone, I know we get a lot of people are be nice. And I remember when we first started VBAC, and I think there's only a few original admins from that time. And I remember talking to the owner of the group and maybe another one. And I'm like, we should be a lot more nicer. Like, we can't be turning these people off. And they're like, that's not how you get, you know, people to listen. You can't be. We've seen what nice does in other groups. And I'm like, yep. And we keep seeing it. So where we were, I think it was 6 years ago, we've changed a lot, but you pick it up. And I'm like, we've got to be nice. We've got, you know, to sugarcoat things, and it never works. It just doesn't work. So.
No, I agree. I was actually going to speak to that, the really having to, and I say this, having moments even within the groups that you're referenced, thinking the same thing. I don't know, that felt a little harsh that time. I don't know if we needed to like go, and there might be times I even stand by that. We're never going to always be in agreement all the time. There's times where I've been like, you know, that maybe we should have been a little bit, but I will say that whatever force or abrasiveness that our tone may take on when there's something around dangerous advice, it's tenfold of that level of passion for the dangerous advice that is given in non-evidence-based groups. And if you think people bully, it's not bullying. It's really just giving clear evidence-based information. It's not always sugar-coated. And yeah, if people come in giving dangerous advice and really trolling the group, then sure, people aren't going to be nice about it, and there's no need for it. I will take some abrasive, maybe responses to things and maybe turning a few people off if it really does get the message across. And now I find myself, I have to say, I'm so spoiled when I go into these groups that allow for everything and we have to make a space for dangerous advice or not dangerous advice. I have no tolerance for it. I just like, no, wow, how can you sit back and let this how can you sit back and watch like them cheerlead this woman right off a cliff? Like, no, how? And then like, there's been groups where I speak up to be like, hey, that's dangerous. And I get attacked and truly attacked. So that's why I'm like, no one's ever attacking in those groups. It's sometimes stern, clear, not warm and fuzzy. It's certainly not like where I've been doxxed for giving evidence-based advice in groups full of woo. That's for sure. I'll tell you, it's nothing like that. I've had people go real life on me and dox me for simply just being evidence-based in what I say. So I don't think we have to be apologetic, at all for the groups that we are involved in that are evidence-based that sometimes just aren't warm and fuzzy all the time.